According to a recent study, an average of 57 nurses were assaulted each day here in the U.S. last year, and emergency departments in Maine contributed to that statistic. That's why a task force was created by the legislature to look into the issue. And today, that panel presented its findings to the legislature's Health and Human Services Committee. But as News Center Maine's Jackie Mundry reports, one group says they were left out of the conversation.
A nurse who was thrown against the wall suffered a concussion.
The Violence Against Healthcare Workers Task Force says this is a national issue and one that those who work in the healthcare industry are seeing more and more.
But I think hearing the stories of Mainers who are having to struggle with these issues and having to deal with this kind of violence, that just makes it a little bit more personal.
On Wednesday, the Violence Against Healthcare Workers Task Force presented its findings to the Health and Human Services Committee, including recommendations of expanding protections against healthcare workers to include anyone who is working in a hospital setting, not just doctors or nurses, increasing the number of community or mental health placements so folks aren't stuck in hospitals for weeks or months on end, looking for ways to encourage healthcare providers to report these assaults, while also being able to keep their privacy. And at least 2 of the recommendations are already being proposed as new legislation proposed by Representative Ann Perry.
And the other piece of it is these patients are getting no treatment. They're just being held.
Perry and former Senator Ned Claxton are both retired healthcare workers and say this is something that just about every healthcare provider has to deal with at some point in their career. And because of that, something healthcare students should be learning.
Some of that is learning to work with people, learning how to de-escalate a very difficult situation you may find yourself in. Similar dialogue.
Jenny McCarthy and Carly Mahaffey showing up to listen to Wednesday's presentation. They say there are other people's voices that need to be in these conversations, the patients.
There's a lot of frustration right now.
Both McCarthy and Mahaffey say they were assaulted by healthcare workers because of a mental health related concern during an emergency medical visit.
Assumptions were made and I decided that I was leaving. I didn't want to stay any longer, and when I attempted to leave, I was taken to the floor by security and held face down on the floor for absolutely only because I said I wanted to leave.
These women say they want a seat at the table when talking about assault in healthcare settings.
Our voices were just left out of the conversation, and hopefully they're included moving forward.
Senator Baldacci, who is one of the chairs of the Health and Human Services Committee, says he hopes to move all of these recommendations forward, but he also wants to look into civil suits for folks who are accused of assaulting healthcare workers. All of these things will be discussed at an upcoming work session. In Augusta, Jackie Mundry, News Center, Maine.